when I go out, people do look. I mean, they can't help themselves. I mean, they try to be polite, but it obviously, you can see when something's not right.
For 39-year-old Dan Maurer, doing a TV interview about his condition isn't easy.
Did you see that? You saw that, right? Let's learn a little bit more, because I think that's his scrotum.
In my late 20s, I noticed it was a little larger in that area.
Dan's scrotum was getting bigger. His doctor told him to lose weight.
So I was doing 2 miles a day.
Okay, wait a minute. His scrotum is getting bigger and his doctor tells him to lose weight? Now, there are a number of reasons why your scrotum can enlarge. Trauma, if you've got blood and swelling down there, that can make a scrotum larger. If you've got cancer, that could be another reason the scrotum could get bigger. Cysts can cause the scrotum to get bigger. I actually often will see scrotums enlarge when I do liposuction on my patients, my male patients, and then swelling kind of moves down and they call me a day or two after lipo of, let's say, their love handles, and they go, Dr. Youn, why is my scrotum so big? And it's like, I tell them, I didn't touch your scrotum, we didn't do anything with your scrotum, it's just swelling sometimes moves down. So let's find out what's going on with this young guy.
Dan was getting smaller, but his growth was still getting bigger.
Probably a cantaloupe, maybe.
Can you imagine having your scrotum the size of a cantaloupe? Oh my gosh. I mean, wow. That is much bigger than pretty much any of those causes I talked to you about. So now we're dealing most likely with something that's not usual.
Dan was given a referral to the University of Michigan Health System. Again, he was told to lose weight.
As far as they were concerned, that I needed to have lap band surgery to lose weight.
What did they think, that he's gaining weight in his scrotum and that's fat weight? That's just not possible. There's something weird about this story. Now, when a scrotum gets this large, it's most likely scrotal elephantiasis. This is another name for scrotal lymphedema, where you get accumulation of lymph fluid in the scrotum.
It wasn't until Dan saw a show on PLLC that he knew there was hope.
It's tough to deal with it, because essentially this is a sort of a living and breathing freak show.
The show is called The Man with the 132-Pound Scrotum.
Did you see that show? Now, I heard about it, and I did hear that he unfortunately passed. I don't know how much longer after the program, but imagine carting 132 pounds in your scrotum. This most likely is scrotal lymphedema, like I mentioned before. A really, really tough problem, but not very common.
That's when I found out, I was like, well, that's what I have.
The condition is called scrotal lymphedema, a rare condition caused by blockages in the lymphatic vessels. Dan's only hope is a doctor in California who will perform surgery to remove the growth.
Okay, so I know all the guys watching this are wondering, how do you get that and how do I avoid getting this?
That's it, I'm out of here.
There are a number of causes of scrotal lymphedema, and it usually doesn't get to the extent that Dan has. It can be caused by cancer. It can be caused by radiation therapy, where it basically disrupts those lymphatic vessels. But most commonly, this is actually caused by parasites, like worms, like the filarial worm that you can get typically in Africa and Asia. These types of worms can get into your lymphatic vessels. It can basically clog them up, and then you can get this fluid that just builds up over time. In some people, the fluid builds up in their extremities, like their legs, maybe even their arms. In Dan's case, unfortunately, that fluid is literally filling up his scrotum. That is a big deal and a really, really tough problem. I would wonder if he at some point had traveled overseas prior to all of this happening.
Approach to it.
The surgery is dangerous and expensive.
I haven't had marital relations with my husband in, 7 years.
She has not had marital relations with him for 7 years. I mean, what a patient and wonderful woman that she is. I mean, to be committed and to stick with him through that. Now, one of the reasons why they may not be able to have marital relations is because if that scrotal lymphedema is really, really severe, it can literally pull the skin of the penis shaft with it. So it can literally peel that skin off because everything swells so much, and that skin can't necessarily be put back on. And you can imagine if the shaft is literally, that skin's been pulled out and he's trying to, let's say, pee, that could be really, really difficult and could be quite messy. I mean, what a horrible, tough problem that Dan's dealing with. Does your collagen taste like you're eating a burger? Your coffee shouldn't taste like a quarter pounder. Youn Beauty Supplemental Collagen has no taste, but it's made of the highest quality bovine collagen called Verisol. Studies show taking a hydrolyzed collagen supplement regularly can improve the appearance of your skin and even increase the collagen content, which degrades with time. Youn Beauty Supplemental Collagen. All the benefits, but none of the beefy taste. Check it out at younbeauty.com and use the coupon code 20OFF to get $20 off your first order over $99.
A few weeks later, he planned to meet with a surgeon at UC Irvine Medical Center to see about getting the growth removed.
He's like, we can do it in 2 weeks.
So surgery is going to be his best option. There's nothing you can do with medications like an antibiotic or anything like that that's going to make this go away. This is a big operation, and you're talking, what, 80 pounds or something like that in his scrotum. That's going to be a huge operation with definitely a lot of risk. The good news in this type of a situation, though, is typically the testicles are left unaffected. So even though the scrotum is so huge, usually the testicles are not really impacted, and he can basically keep those undamaged.
When he got to the hospital, doctors decided to do more.
So I still had like a flap of skin that hung down. Even once they were to remove the scrotal lymphedema, I would still have problems urinating, cleaning, keeping that area clean. So they're like, you know what, let's remove this area so we don't run into problems.
So it sounds like he's got that large scrotum, but on top of that, he's got a panniculus, which is a huge fold of skin that overhangs. So even if the scrotum is reduced in size, if you've got a big panniculus there, you literally cannot see your penis. Now, once again, if his penis shaft skin has been completely pulled off of it, then usually you have to reconstruct that with skin grafts to get rid of a panniculus so it's not in the way. Sounds like a pretty good idea. But the problem is this is a lot of surgery at one time, and the longer that you're under anesthesia, the higher the risk of complications.
The surgery lasted 16 hours and it was considered a success. When he woke up, the growth and extra skin were gone.
The scrotal lymphedema itself weighed 80 or 85 pounds, and then the pendectomy was like another 25, 30 pounds.
Wow, that is a lot of time to be under anesthesia. And when you're under anesthesia for this long, there is a higher risk of major complications like blood clots, like a pulmonary embolism. You have a risk of pressure sores because if you're lying in the same position for 16 hours not moving, that's a definite risk. There are other risks of anesthesia-related complications too when the surgery goes this long. Now, the fact that they removed 25 plus pounds from his abdomen, that is actually the most I've ever removed from somebody. At one time was 25 pounds from a woman's abdomen. She had so much skin on her tummy that it literally went past her knees. That's how much skin Dan was dealing with. Can you imagine dealing with that much skin and an 80 to 85 pound scrotum? God bless this guy getting through this and getting that surgery done, and his surgeons for taking him on. That is a huge, huge undertaking.
Dan lost over 100 pounds, but there was a complication from the surgery.
Wondering why my legs were numb. Thinking that's not right.
Doctors disturbed a nerve, and Dan had trouble walking.
Essentially, I'm going to have to reprogram my legs to walk again.
Oh, wow, that's tough. I mean, a panniculectomy, which is an operation that I do fairly often, should not come with the risk of not being able to move your legs afterwards. So I'm not quite sure of the anatomy and the physiology of how this works out. Is this a positional thing? Was he in a weird position for a long time and maybe that caused some nerves to get pinched? Or is it possible that during the scrotal surgery they got too close to a nerve? And it's tough to say, but hopefully he has a quick recovery from this. And I tell you, as a surgeon who operates to try to help people, the worst thing is when you do an operation and you think it's successful and there's an unexpected complication. That just, I mean, it's horrible for the patient, but it's also horrible from a surgeon's perspective. That's when I really beat myself up and go, geez, is there something that I could have done? So, I mean, I feel for Dan so much in this situation, but I also feel for his surgeons who were trying to do the best they can, obviously, and he had this type of a complication.
It's been, bro, the hardest thing I've ever done in my life.
Despite Dan's new challenges, he says he wouldn't change a thing. He says he will walk again, and thanks to the surgery, he will have a normal life.
So if you know what's happened to Dan since this video aired, I'd love to hear about it. If you can let me know in the comments below, that would be awesome. Well, can you imagine, like Dan, living with an 80-pound scrotum? Well, what about living with a 20-inch penis? Yes, there is a guy who claims his penis is all of 20 inches long, and I react to his video right up here. These visuals you will remember for the rest of your life. And remember, eat real food, use clean skincare, and always auto-juvenate before you operate.